So which drug treatments work best for hay fever? So I'll be talking about the drug treatments that work best for hay fever, and if you stick to the end, I will tell you about the drug treatment that you can take if none of these drug treatments work. Hay fever, as we know, is due to allergy from pollen such as the grass and the trees. Bless me. So hay fever presents with symptoms such as itchy, watery eyes, you get a runny nose, sneezing, tickly throat, itchy ears, and in severe symptoms you might get wheezing and chest tightness. So now the question is, what drug treatment should I take that works best? So here we've got Fexofenadine, 120 milligrams. We've got Loratadine, 10 milligrams. We've also got Cetirizine and Piriton. Now, what drug treatment is best is not as simple as that, as it all depends on how quickly you want the drug to act. It depends on previous experience. It also depends on side effects. So what's best for you might not be best for someone else. However, the general consensus is that Fexofenadine 120 milligrams has shown to be more effective than the rest of the hay fever medications. If you take Piriton, for instance, Piriton is very quick acting. However, it has to be taken a few times a day to continue its effects due to its short acting period, and also it can make you feel drowsy. Cetirizine also is a long-acting medication, but for some people, if that doesn't work, they usually switch to a different alternative hay fever medication like Loratadine, for example. And also if that doesn't work, then it's worthwhile trying Fexofenadine 120 milligrams. Now, Fexofenadine was previously on prescription only, which means that you could not get this over the counter, but recently that has been changed, and you can now get Fexofenadine 120 milligrams under different brand names such as Allegra, for example. What's this one called? This one's called Piriteze, but the common brand is called Allegra if you're ever looking for Fexofenadine 120 milligrams, and that's usually taken once a day. In terms of hay fever medication, I usually advise that sometimes one tablet might not cover all your symptoms. So for example, if you had itchy, watery eyes, you might need to use eye drops in conjunction with hay fever tablets. If you had sneezing and runny nose, you might find that you might have to use something such as a steroid spray, for example. I would strongly recommend a strong steroid spray like Avamys or Nasonex, or fluticasone steroid sprays, as opposed to your over-the-counter steroid sprays such as Beconase, which are quite weak and are not as effective. Also, in terms of non-drug treatments, which I will not cover in detail, you have got Manuka honey. Most people swear by Manuka honey. They will tell you that they line the nostrils with Manuka honey, or they take a spoon of Manuka honey a day, which you can also mix with warm water, and it helps to fight the symptoms caused by pollen. So just imagine you've tried Cetirizine, you've tried Loratadine, you've tried Fexofenadine, you've tried your steroid sprays, Manuka honey, and nothing else works. What's next? Well, one medication that is found to be quite effective in terms of dealing with hay fever symptoms quickly is called prednisolone. Now, prednisolone is a steroid medication that's usually used for other indications such as asthma, for instance. So prednisolone can usually be taken at 0.5 milligram per kilogram of your body weight. So for example, if you weigh 80 kilograms, which means you need 80 times 0.5 milligrams, you need 40 milligram tablets to be taken once a day, and the duration is usually taken for 5 days. A lot of people that take prednisolone treatment as a last resort have found quick relief of the symptoms, and it's found to be quite effective. However, there are side effects of prednisolone, so long-term use of prednisolone or frequent use of prednisolone, i.e. if you find yourself using this tablet more than 4 times in a year, you're at risk of having symptoms such as diabetes, weight gain, mood swings, swelling in the legs due to water retention, as well as a host of all other symptoms. And going back to the effects of Fexofenadine 120 milligrams, if you find that taking one tablet once a day does not help with your symptoms, you can actually take one tablet twice a day. So taking one in the morning, one in the evening. Possible side effects might include making you feel a bit drowsy, even though Fexofenadine is a non-drowsy medication similar to your Loratadine and Cetirizine. The only drowsy medication here really is Piriton. You've also got other over-the-counter remedies like Benadryl. These are also found to be drowsy medications, so they're not ideal if you're working or if you're driving or if you're looking after kids. So my number one choice in terms of hay fever treatment would be Fexofenadine, taken in combination with a spray such as Avamys or Nasonex, as well as eye drops such as Optrex, for instance. I hope you find this video quite helpful in dealing with your hay fever symptoms, and if you have any further suggestions, please feel free to drop some comments below.